Good morning and welcome to this 15th in the Milken Institute series of conference calls related to the COVID-19 pandemic. We've covered everything from the health and research aspects of the crisis to the financial and economic impacts, to the philanthropic response, to the mental health impacts. My name is Esther Krofa, and I serve as Executive Director of Faster Cures, a center of the Milken Institute. Today, we're here for an on-the-ground view of how testing will help in reopening the U.S. That process is very much already underway, and stay-at-home orders or shelter-in-place orders have already been lifted for a vast majority of the states. Only 4 or 5 states in the District of Columbia are still under stay-at-home orders. Many experts have indicated that we need robust testing and contact tracing to stay ahead of the rates and continue to keep them down. We are pleased to be joined today by 2 leaders at the forefront of these issues, both at the state level and the private sector perspective. This webinar is being recorded, and you can submit your questions in the Q&A box on the bottom of your screen. I'd like to begin by introducing and welcoming Governor Gina Raimondo, a very popular 2-term governor of Rhode Island, the first woman governor of the state. Before becoming governor, she served as Rhode Island's general treasurer, has a general background in venture capital. We will start with a discussion with the governor and then hear from Mr. Adam Schechter, President and CEO of LabCorp, a world-leading healthcare diagnostics company. So, Governor Raimondo, we're tracking your state. I see that there's been over 115 tests conducted to date as of yesterday, a little over 12,000 tests that have come back positive, and reporting about 500 fatalities. Why don't we begin by just hearing from you? How are things going in your state? What has been the experience to date? How are your residents faring from both a health and economic perspective?
So good morning, and thank you for having me. I appreciate the way you've modified your format this year, and I think it's great that you're continuing to go forward with the interview. So thank you for having me. We're doing very well. Obviously, it's incredibly difficult, but considering what's been thrown at us in dealing with this virus and the fact that we've only been at this for 10 or 11 weeks, I feel very good about where we are. You mentioned testing. Rhode Island is way ahead of the pack when it comes to testing. We have tested nearly 12% of our entire population, which was a difficult thing to have accomplished. We've been able to do that because we've really embraced innovation. I'd say innovation is carrying us through this crisis, and a lot of public-private partnering. So in all aspects of how I've been managing this crisis, but here with testing, it's absolutely true that we wouldn't be where we are without great corporate partners and private sector partners, starting with CVS, who launched with us a rapid testing site to do thousands of people a day. We're also partnering, obviously, with Abbott for the Abbott ID Now machines, partnering with local members of our healthcare community to make sure we get into communities. That's the issue. We need to be in communities where people are. We are seeing outbreaks in certain urban communities, and so we're doing a lot of walk-through testing. Not everybody has a car. Not everybody can drive to a testing site. So we're setting up mobile testing operations in parking lots of schools where people can walk right there. We have what we call an SOS system of testing. S is for symptomatics. We want everybody who has symptoms to be able to get a test in a day and results in another day. O is for outbreaks. Anytime we have an outbreak, we want to be on the scene within 4 hours and test everybody. And then the other S is for surveillance. We want to have constant surveillance testing in the population to see where folks are. The name of the game is staying ahead of the virus. If the virus gets ahead of you, it's a bad place to be. So my whole focus has been stay a step ahead of the virus, and that's where we've been able to stay. We're reopening our economy in a slow, steady fashion, I've got to get folks back to work, but I'm only reopening once. I don't want to go backwards, so it's slow and steady.
Can you talk a little bit more about that, Governor, in terms of your phased reopening approach? Describe what the phases are and where you stand right now in each of those phases.
So we have roughly charted out 3 phases. We said there'll be 3 phases. We're in the middle of phase 1 right now. We think there'll be about a month between phases, between 3 and 4 weeks between the start of one phase and the start of another phase. Phase 1 began on May 8th when I lifted the stay-at-home order. So we're, that 10, 11 days into that phase. In this phase, we are allowing social gatherings of 5. Folks can slowly start to go back into the office. Manufacturing is up and running. Construction is up and running. Retail is open with new restrictions, obviously. Yesterday, actually, we started up again with outdoor dining. And so far, so good. I mean, people are really following the rules, wearing their masks, being socially distant. Phase 2, we hope to start very early June in phase 2, and there'll be continued relaxation, moving to in-room dining. Social gathering limit will increase, greater relaxation for retail, hairdressers, barbers. That'll all be phase 2. And then hopefully about a month thereafter, we'll move into phase 3, which will be further relaxation and further enablement of the economy. My focus is we have to get people back to work. So I have tried to keep a lid on social gatherings, but really enabling commerce, because frankly, too many folks are out of work, and often the people who are out of work are the ones who can least afford it. If you have a professional, high-paying job that's, for lack of a better term, kind of a technology job or any sort of a professional job, chances are you still have your job and you're working from home. Now, you're inconvenienced, for sure, but you haven't lost your job. You're doing your Zoom meetings at home, on your phone, and on your laptop. However, if you're someone who only has a high school degree and you're in retail or food service or tourism, you can barely afford to get by on a good day, and coronavirus has really hit you hard. So I have my eye on all those folks who I'm trying to get back to work safely.
You've raised some really good points in terms of reopening the economy. And one of the concerns I'm sure that you've heard consistently, and perhaps even for your residents as well, is what is the guidance being provided on which individuals can get access to a test? Does it remain the case that when individuals are symptomatic, as we see people go back to barbershops, to hair salons, to nail salons, et cetera, how do we ensure and keep track of where potential outbreaks may occur, or how individuals can rapidly access testing? And you have been at the forefront of this with all the public-private partnerships that you've talked about. But how do residents access testing? What is your current guidance?
So listen, throughout this crisis, I have been very focused on equity. We are working every aspect of this with an equity lens. It is not okay if only certain people can access a test. I think there needs to be equal access to testing without regard to your income, race, gender, immigration status, or zip code. And so that's why we have a multi-pronged approach to testing, so that, if you work at a big company, like on a corporate campus, your company may be providing you with, testing once a month or regular testing, and that's a great thing if that's what they want to do. But I also need to make sure that every Rhode Islander, if they feel sick, can get a test within a day, period, and then get your results within another day. As of this past Monday, we had tested all of our residents and workers in every nursing home in Rhode Island. And we're going to continue to do regular testing and regular intervals of residents and workers in nursing homes. We have testing in the community, in some of our poorest communities. And actually, I want to ramp that up because this is where we're seeing some outbreaks, you know, in densely populated urban areas. So that is my view. I think this is about equity as much as it is about public health. And it's just the right thing to do. By the way, it's the right thing for everyone. If you have an outbreak at a manufacturing plant, within a nursing home, in an urban community, in a poor, densely populated housing complex, that puts everyone's health at risk. So that's why we're taking it very seriously.
Absolutely. And one of the questions that's top of mind, particularly for individuals like myself who are parents, are what's the plan for schools reopening? How do we ensure, as we're hearing more and more about potentially rare cases in pediatric situations, and you know, COVID-19, how are you thinking about reopening the schools, whether in the fall, continuing distance learning? How are you thinking about that and using the data that you're gathering to inform those decisions?
So we are planning to open school in the fall. Now, in the world of coronavirus, plans can be changed at the drop of a hat, but that is the plan. I have said all along, we're going to plan for the worst and work for the best. So we are, in this case, working for the best is going back to school. I think these kids deserve it. Distance learning has been great, but it's not the same thing, and we can't let kids fall behind. So I'll say that, you know, we are working through, right now, we are working through what are our plans, like, do you test every student at the beginning of the year? Do you test every teacher at the beginning of the year? In what intervals do you continue to test kids and teachers? Just to give you a frame of reference, in Rhode Island now, we are doing between, we'll call it 3,000 tests a day, plus or minus. By July, we want to be doing 10,000 a day. And by the time school starts, we want to be doing 15 to 20,000 a day. We are ramping our capacity. We have 20 colleges and universities in Rhode Island, very small state, a lot of colleges and universities. That's a lot of testing. So we're going from 3 to 10 to 20,000 between now and call it end of September. So that's our plan. I do want to say this, testing is not a silver bullet. And in fact, over-reliance upon testing has problems of its own. You know, what we know, testing helps us to isolate people who are sick, and that's critical, and to deal with outbreak, and that's critical. But it is not a substitute for social distancing, hand washing, mask wearing, deep cleaning. And when you say school, I'm confident we'll figure out how to do the testing. What I worry more about is making sure we don't get lax in our social distancing, hand washing. No one goes to school if they're sick, even with the sniffles. That's the discipline we're going to have to keep up.
Absolutely, particularly as we go into the fall season, which is likely going to be also coupled with the beginning of the flu season as well. I know that it's a busy time for you and your day is very much packed. Before we end, I would just like to get your perspective on what are we not hearing that we should be focused on from a reopening perspective? What keeps you up at night that we need a comprehensive solution to tackle that we may not be addressing either at the state or the national level?
Well, the list of what keeps me up at night is quite long, and I know we're trying to wrap up. Listen, high on my list is the amount of economic suffering that we have out there, as well as the non-COVID related healthcare issues, whether they be mental health or physical health. You know, a lot of very disturbing facts in my state around, cancer patients putting off cancer treatment because they're afraid to go to the hospital. So that worries me. So what that tells me is I need to continue to build systems that create confidence so people feel confident to go see the doctor, to go to the hospital, to go back to work, to go out to dinner again, to reopen their hair salon. And that's testing. That's also contact tracing, another area where we've partnered. Salesforce, Mark Benioff and his team at Salesforce have been nothing short of phenomenal in helping us. We have the folks at Infosys similarly have stepped up to the plate to help us build an awesome contact tracing system. So these systems matter because I want people to have confidence so they have the courage to come out of their houses and start living life again, which is going to enable us to get people back to work and, as I said, take care of their other healthcare needs. I can't make this virus go away. That's out of my control. Thank God we have awesome scientists who are working on vaccines and therapies. So I'm just trying to focus on the things that are within our control and creating a system in Rhode Island to help us live with the virus until there's a cure.
Well, we certainly appreciate your tremendous leadership. It's not an easy time, but what we need is clarity. We need plans. We need to have these technologies in place. It's an all hands on deck effort as you're inviting the private sector to join with you in the response to this pandemic. And we commend your leadership in leading your residents there in Rhode Island. And we thank you for joining us this morning.
Thank you, Esther. Good luck. It's great to see you or see your picture on the screen. And again, thank you for doing this. And to everybody out there, this is such a hard time for everybody right now. So whether you're a business leader or employee, student, parent, government leader, we're just going to hang tough and get through this together.
Absolutely. Well, take care and best of luck to everything.
Thanks so much.
I would also like to add Adam, Mr. Schechter, to this conversation, and you have been a key leader in providing exactly what we've been talking about, the technology, the tools, the diagnostic, to be able to very quickly identify individuals who are potentially positive for this virus. And as we talked about even before this discussion started, you have been working in your team almost 24 hours, 7 days a week in response to this virus. Can you talk to us a little bit about what the ongoing state of play is with regard to the amount of tests that are available at a national level? We've heard quite a bit of discussion about the capacity of state labs, the capacity of commercial labs. Tell us a little bit about what you're seeing in the broad landscape, and then we'll dive into some additional questions.
Absolutely. Good morning, Esther, and thanks very much for having me here today. These are certainly unprecedented times for the world, the United States, for businesses, including LabCorp. I'm very proud of what our 65,000 colleagues for LabCorp around the world have been able to accomplish, and not just the testing that we've done for the U.S., which is substantial, and I'll talk about in a moment, but also what we're doing with our drug development team to help pharma and biotechnology colleagues to develop potential treatments and vaccines as quickly as possible. We also have our LabCorp Employer Services Group that is doing everything it can to help companies across the United States get back to business as quickly as possible. So to answer your question, to date, LabCorp has performed almost 2 million PCR tests. The PCR test is a test that tells you whether or not you currently have the disease. We can now do about 75,000 tests per day. And by the middle of June, we expect to be able to do 150,000 tests per day. At the same time, the antibody test, which is a test that tells you if you've had the disease in the past, we've done over 500,000 of those so far. And right now, we can do more than 100,000 per day. And by the middle of June, we'll be able to do more than 300,000 per day. So you can see we continue to build extraordinarily high levels of capacity. Our teams and our scientists, as you said, they're working around the clock in order to do everything we possibly can to help with the global pandemic.
Thank you for that overview. It absolutely sounds as though the scale is rapidly increasing and will get us to the levels that we need to see as we see more businesses and more states and the economy writ large reopen. One of the questions that many people have been asking, what is the role, you talked a little bit about it, the role of serology tests versus the PCR tests in individuals knowing that they may potentially not get reinfected if they have antibodies in their system. Are you engaged in studies to not only conduct these tests and provide the data, but also what can we learn from that? How can individuals feel confident and when they go back into the economy, they may be protected?
Yes, I'll start off with the PCR test. That's the test that tells you whether or not you have the disease currently. They're highly accurate. We can do those in 1 to 2 days from the time that they reach our labs. The antibody tests are also very accurate. If you look across our platforms that we have for the antibody tests, they're anywhere from 99 to 99.8% specific to COVID-19. But there's still a lot of science that needs to be done on the antibody tests. We know if you have antibodies that you have faced the virus and you've beaten the virus in the past. What we don't know for certain is whether or not it will prevent you from getting the virus in the future, and if it does, for how long it will prevent you from getting the virus in the future. At a minimum, I think it helps with confidence for people to know if they have the antibodies, but at the same time, I think it's important that anybody, including those with antibodies, continue to be very careful as they enter the workplace.
And when we talk about the scale that is needed, can you talk a little bit more about, as you're ramping up to conduct hundreds of thousands of tests a day, what does that tell us as we continue the reopening? Will individuals be able to access these tests when they're symptomatic? If they're not symptomatic, are you following the guidelines of state and public and national health agencies and organizations?
So we've definitely built significant capacity at LabCorp, but also across the United States. Yesterday, I heard that there's been 11 million tests done to date in the US, which when you think it's only been about 6 to 8 weeks since the commercial labs have been really involved, that's a very significant number. And as I mentioned, we're going to continue to build significantly more capacity as we go into the middle of June and throughout the summer. There's nobody that knows exactly the number of tests that will be needed. My philosophy has been build as much capacity as we possibly can, as fast as we possibly can, with the best turnaround time as you can humanly possibly do. So that's what we're doing, just build as fast and as much as possible. With regard to, go ahead.
No, please continue.
I was going to say, with regard to thinking about going back to work, I would say the first thing is we have to have a mindset of prevention, meaning businesses need policies to encourage people that feel sick with symptoms to stay home and to get tested. The second thing I would think about is as people are coming onto sites, whether it be a manufacturing site, a laboratory, or even a corporate headquarters, you have to try to prevent those with symptoms from getting into the workplace. And there's things like temperature checks and questions that you can ask people. Those are more about building confidence, I believe, than science. But if anybody has any sense of symptoms, you should send them home and have them tested. Testing is going to be important, but track and tracing is going to be equally as important. So anybody that's been exposed to somebody with symptoms or that tests positive for the virus, you need to isolate them and also test those as well. I can tell you there are some businesses that are considering antibody tests for everybody before returning back to work. I think that's going to differ potentially based upon if you're in a hotspot where there's been a significant number of people that have had the disease, or if you're in a part of the country where there's not that many people that have had the disease. So there's still a lot of discussion going on the best way to get people back to work.
And in that context, is testing at home, is that a real option yet? You've developed an at-home test kit and others are likewise following in suit. When can individuals expect potentially to access at-home test kits? And is that something we should be waiting for?
Yeah, so we announced last week that we are making our Pixel at-home test available very broadly. Anybody meeting the CDC criteria can go online at labcorp.com or pixelbylabcorp.com and have access to get an at-home test. What happens is you have the test that's shipped to your home overnight. It's a very simple nasal swab, and then you ship the test back to us overnight, and then we can perform the test in 1 to 2 days. So I think it's in a very important way as we try to keep people with the disease isolated from other people. This way they can stay home, get the test, and have the results very quickly.
FDA has been moving very, very quickly to ensure that we have access to these kinds of technologies that you just mentioned, and have provided access through the use of emergency use authorizations and other mechanisms and guidance. What do you think has worked well, and where do you think things continue to need improvement to ensure we have access to the best technology available from a testing perspective?
I have to say the FDA has been terrific to work with. I mean, you can reach them around the clock, 7 days a week, and they're working as hard as they can to work with us and all organizations to try to not only get testing available as quickly as possible, advances in testing as quickly as possible, but also, as you can see, treatments and vaccines. And I've been involved in this industry for more than 30 years, and to see the FDA moving at this speed is just remarkable. So my hats is off to all the people in the FDA working so hard through this pandemic. With regard to issues that we faced, there early on were some issues with supplies. I think most of those have been resolved now. And what we've done is we've built our tests, both the PCR test and the antibody test, on multiple different platforms, meaning that if there's an issue with supplies on one of the platforms, we can still continue to run those tests broadly through the other platforms that we have up and running.
And we've had some audience questions come in, and that was very helpful, Adam. One of the questions from the audience is, how should we prioritize who has access to testing? Should we assume that capacity is infinite? And I can imagine what your answer is, but we'd love to hear your perspective on that.
Yeah, so I believe that according to the CDC guidelines, anybody that meets those guidelines should have access to testing, meaning those that have symptoms or those that have been exposed to symptoms, and even those on the front line in healthcare and first responders. And I believe that the capacity that we have today is enough to get phase 1 up and running. And as we build capacity throughout this month and into the end of the summer, I believe we'll be ready for the fall to make sure that we have the capacity to ensure that testing is available for everyone that needs it according to the CDC recommendations.
And from the antibody serology testing perspective, what are you seeing in the trends with overall positivity rate? One of the big questions out there is, do we have herd immunity, or where is that potentially in different communities to give individuals confidence that a majority of people have had it, they've sufficiently recovered and maybe protected going forward? Are we seeing that kind of data prove out from the antibody test results that are coming in?
Yeah, not surprisingly, in hotspots, we see a higher prevalence of people that have the antibodies, but still in many parts of the United States, we're seeing very low levels of antibodies. When you think about it, you know, if 7 to 10% of the population has been impacted in a certain state, you're not going to see antibody levels higher than that. But if you look at parts of the country where there's been 30% that have been exposed or that have been diagnosed with the virus, then obviously you'll see people there with higher antibodies. At the same time, I think what the governor just mentioned is critically important. We have to make sure that social distancing, hygiene, washing your hands, wearing masks, and cleaning the workplace is going to happen all the time until there's a vaccine. So I hope we don't reach a level of the herd immunity, because I hope that there's a vaccine well before that.
You know, you spoke to this a little bit earlier because you have such a depth of experience in biopharmaceutical industry with your time in leadership at Merck, and you're partnering and working with that industry in the push toward either a treatment or a vaccine. Can you talk about the efforts underway in those partnerships, and what hope do we have in seeing a therapeutic potentially even before a vaccine come to market?
Yeah, so we have a significant drug development business that works with pharmaceutical and biotechnology customers around the world. And the number of trials on ClinGov for COVID-19 is so large and has happened so quickly that I have a lot of confidence that our colleagues will develop new treatments and new vaccines that will work. I can't remember a period of time where so many companies have been working so fast, and the regulators, including the FDA, are partners with them to do everything possible to get new treatments and vaccines. So I'm very hopeful about that in the future.
Great. I would agree that there's been a tremendous amount of movement, of collaboration, of focus on both the therapeutic and the vaccine side. I do want to bring us back really quickly to the question of testing from another question that came in from the QA box related to should we have any concerns at all about the accuracy of either PCR tests or antibody tests? I imagine this is most relevant to antibody tests, as PCR tests have a very high level of sensitivity.
Yeah, the PCR tests and the tests that we run are very highly sensitive and highly accurate. The antibody tests that we're running are also highly accurate. And as I said, if you look, the specificity towards COVID-19 for the antibody tests we're running are between 99 and 99.8% specific, so very high level of accuracy. However, there have been a lot of other serology tests on the marketplace that don't even have EUAs from the FDA. So I would just say you have to be careful, and I would choose a lab that has tests that they're using that have been approved through EUAs.
And how would residents or individuals know where to find the most accurate tests? It does seem that there is going to be quite a reliance on public health officials giving clarity on the tests that are either approved through emergency use authorizations or are the labs of choice at that state or community level. Is that correct? Individuals may not necessarily be able to know the landscape and determine which tests may have some accuracy issues.
Yeah, I would say the regional, the local, and the large commercial laboratories, as well as the academic medical centers, are using tests that have EUA approval. The FDA has on its site a list of tests that have EUA approvals, and it should be relatively easy for people to find.
Great. Well, I'll ask you the same question that I asked the governor, which you may have a long list as well. What keeps you up at night? What is your hope for the next several weeks, for the next several months ahead?
So I'm optimistic about the future, but we're going to have to all work together across the United States and around the world because this is a global pandemic. And we're going to have to make sure we continue to be vigilant on the social distancing, the hygiene, but also making sure that we remember that this virus is still here. And what I worry about most is that people become a bit complacent as we go into the summertime and that we're not as thoughtful about ensuring that we are as vigilant as we have been. The second thing is I also agree that the testing outside of COVID-19 has decreased substantially. And I worry about people that have diabetes, that have cancer, that have all these other ailments, not getting the treatments and the attention that they need in order to prevent other disease. So we have to stay vigilant on that as well.
I would agree with those sets of comments, and we thank you for the leadership that you have provided, for the work of your entire organization as you've ramped up very quickly in providing these needed tests and also continuing to expand that capacity in the next several weeks and months as we go ahead. So thank you for all that you are doing, and we look forward to hearing more good news about the virus being contained and going down. And I agree that we need to be vigilant as these summer months. The data lags over a course of time. We won't know where these spikes are occurring until we see data, usually 2 or 3 weeks from when reopenings have happened. So we will continue to encourage individuals to monitor and align with public health advice. So thank you so much for joining us today and offering your perspective on testing.
Thanks so much for having me, Esther. It's a pleasure to meet you.
Wonderful. Well, for everyone else, we look forward to having you at our next webinar discussion on May the 26th. And you have the details here on the slide. The topic will be Life in Isolation, How to Fight the Loneliness Epidemic. Thank you so much. We look forward to seeing you then.